In this video, I'll be discussing what pertussis and croup are. You may know them as whooping and barking cough. I'll also provide you information around the definitions, symptoms, and if you stick around to the end of the video, what the home and medical options are for your children. Hi there parents, it's Dr. Iviano here. I'm a neonatal pediatrician with over 30 years of experience. However, today I'm not speaking to you just as a pediatrician, but also as a dad of 3 children. And of course, no matter my education, my training, or common sense, when we were faced with any issues around the health of our children, we reacted first and foremost as parents. So don't worry. Today, we will discover these issues together, and I'll tell you what, while I'm giving you a lot of information, it's simply to cover as wide a spectrum as possible. So that way, you are more informed. This doesn't mean that all children will go through severe cases. I'm also assuming that if you're watching this video, that you may have concerns around the cough that your little one is exhibiting. If after this video you feel the need to go see your pediatrician, then don't be shy, do it. Better to be safe than sorry. Let's get to it. As I said before, as a pediatrician and as a dad myself, I know just how nerve-wracking it is when your little one comes down with a nasty cough. 2 conditions that really have parents worried are croup and whooping cough, also called pertussis. While they both involve a lot of coughing and gasping for air, there are actually some major differences between the two that impact how we treat and how we manage them. Let's dive into the details. But remember, I'm providing this for general information only. See your doctor for personalized medical advice when you feel the need. What are the whooping cough stats? Before we get into the specifics, let's look at just how widespread whooping cough is. Despite declining cases thanks to vaccines, this bacterial infection still affects an estimated 24 million children worldwide each year. That's no joke. What are the symptoms of whooping cough? Who are most at risk? With whooping cough, your child will have those intense, uncontrollable coughing fits. They end with a hallmark whoop as they desperately gasp for air at the end of the cough. This is because the pertussis bacteria is inflaming and irritating the smaller airways deep down in the lungs. The cough spells can be really scary to witness, especially in the very young infants. Infants under 6 months and the adults over 65 are at highest risk for severe whooping cough, as well as those with pre-existing conditions like asthma or chronic obstructive airway disease. In infants, complications can be really scary and life-threatening, including seizures from lack of oxygen. What are the symptoms of croup and who are most at risk? Croup, on the other hand, causes that trademark barking cough that sounds just like a seal. This comes from swellings in the upper airways and the voice box, caused by the virus, typically parainfluenza, or sometimes RS, which also causes bronchiolitis. Younger babies may make a harsh, high-pitched stridor breathing sound that's pretty terrifying for parents. And while typically milder, severe croup can be life-threatening in infants under 6 months of age if the airway gets too blocked. So please see a doctor immediately if your infant is drooling, unable to swallow, or has severe stridor at rest, which is not normal. The causes of whooping and barking cough, also known as pertussis and croup. The key difference is that croup stems from viruses, while whooping cough is a bacterial infection caused specifically by Bordetella pertussis bacteria. Whooping cough is also way more contagious and can be quite serious, especially for babies under 1 year old who may need to be hospitalized. What is the treatment for croup? For mild croup cases, some home remedies can be shown to provide some relief. Simple things like running a hot shower so that you can breathe in that steamy air and loosen up the secretion. But for more moderate to severe cases, there may be a need for medical treatment, including steroids, to directly reduce the airway inflammation and make the breathing easier. What is the treatment for whooping cough? With whooping cough, antibiotics are absolutely essential. You have to treat the bacterial infection and prevent it also from spreading to others. The antibiotics help kill off the pertussis bacteria, and even with antibiotics, the cough can last for weeks or even months as the airways heal. With severe cases, especially in infants, they may also need to be hospitalized where they need oxygen therapy and perhaps breathing support. So please head to the ER if your child is turning blue or having pauses in breathing during cough fits. Don't forget to keep infected children away from those with high-risk respiratory conditions such as chronic obstructive airway disease and also asthma. Think grandparents and new babies. How do you prevent whooping cough? As a pediatrician and a parent, I really have to stress how important it is to prevent whooping cough through vaccinations. The DTaP vaccine protects little children. Doses are given at 2, 4, and 6 months, and then boosters later on. And we now recommend the Tdap booster during every pregnancy so the mom can pass those vital antibodies to her newborn. In addition to vaccines, good preventive measures include keeping your children at home when they're sick to avoid spreading the illness, practicing good cough etiquette, like covering your mouth and frequent hand washing. For household members exposed to whooping cough, your doctor may also prescribe antibiotics to prevent transmission. One of the key takeaways of Pertussis and Croup, while both involve nasty coughing spells, Croup and whooping cough differ in causes, severity, treatment and preventative steps needed. Croup thankfully is milder and resolves quicker, while whooping cough is bacterial, tends to be more severe, requires antibiotics, and can have quite serious complications, especially in the high-risk groups. So stay on top of those vaccination schedules. They really are important. Practice good cough etiquette, cover your mouth, and don't hesitate to call your paediatrician if your child is coughing and struggling to breathe at the same time. Being an informed parent can really help you stay calm, get all the proper care you need. I really hope this breakdown provides some clarity around these two conditions so that cause so much parental anxiety. But again, I'm giving you general information here, so please see your doctor for personalized medical advice, especially if symptoms are severe. As doctors and parents ourselves, being knowledgeable allows us to make the best choices for our little one's health and well-being. When your child is okay, your family is okay. And remember, I'm speaking to you here as a parent with information. This is not a diagnosis. It's not a consultation. If you enjoyed the video, please do like and subscribe to the LU Health channel. We're producing content for you, so please do share with us what subjects you'd like to see more of. In the meantime, be safe, and until next time, stay healthy.